every month here we talk about diabetes, but today we're talking with our other monthly guest, Rob Wilson, who's an Ottawa paramedic. Because when you know someone with diabetes and something happens and you don't know what to do, Rob is going to tell us today what you need to do. Thanks so much for being here.
Good morning.
Okay, so there are two extremes, I believe, when it comes to diabetes. There's one part where the sugar level drops completely, yep. And then what's the other one?
There's another level where your sugar goes too high.
Okay.
Now, what kind of numbers, I mean, we've talked about it on the show before, but for a first-time viewer, what is diabetes? How many people are affected by it?
Well, Ottawa Paramedics deal with diabetics every day. It's an affliction or a condition, it's not really a disease, that affects over 2 million Canadians. 1 in 7 Canadians will die as a result of diabetes, and it's the 7th leading cause of death.
It is a serious disease.
It is a very serious disease.
Okay.
So what it is, it's basically an imbalance of the inability of the body to produce insulin, which we need to transport sugar into our cells. I won't get into a big long description, but a person that has diabetes can't produce enough insulin, so they have to take medications or synthetic insulin to produce it. Mm-hmm. A person that has diabetes, we're concerned as first aiders when they go too low. Their sugar level gets too low, so they take too much insulin and their sugar level drops rapidly, and they start to exhibit the signs and symptoms of having a diabetic reaction.
So what are these signs and symptoms, Rob?
A person that is having a diabetic reaction, they need sugar for their brain to function properly. In addition to oxygen, the brain needs sugar. It's affected the most out of this condition. So they start to act a little confused. They may actually be irritable or combative, appear to be drunk. They'll be pale, cool, very sweaty, and they can actually go unconscious, go into seizure, and then actually result in death. It's a very rapid condition that can result very quickly.
Will they be able to determine themselves that something is wrong, or is it someone in their vicinity that will be able to pinpoint, uh-oh, this person isn't acting normal?
Some diabetics can recognize it coming on, and they'll take the sugar. They'll have like hard candies, they'll have sugar to take with them. Right. But other ones, they're called brittle diabetics. That's the one the paramedics run into the most. It just hits them rapidly, and they drop fast. Okay. So the main thing is to make sure that a diabetic, if they're watching, should have a medical alert, and most of them are very good, and they keep information or some type of identification so we can treat them when we get to them.
Right, and obviously the first thing to do is to call the paramedics. While you're waiting for the paramedics to get there, is there anything that you can do for them?
Yeah, the thing that the person needs the most is sugar.
Okay.
If they're able to swallow, and that's the highlight, make sure that they're conscious and able to swallow. You can give them a sugared drink. So fruit juice mixed with sugar mixed into it, a soft drink, not diet, with sugar mixed into it, because that happens sometimes. And make sure that you treat the ABCs. If they're unconscious, address their airway, their breathing, and their circulation first, and then go to the next level.
Okay.
Now, as paramedics, we find that it's very easy to treat diabetics if they're having blood sugar problems. So we arrive, and in addition to them getting sugar from us, we'll treat them with intravenous medication, which are right here. This is dextrose. It goes into the vein, and it will bring a diabetic around within 5 minutes.
All right.
And this right here is glucagon, which diabetics can actually get prescriptions from their doctor to treat themselves with. It's a hormone that causes fat stores to break down and brings their blood sugar up. And then there's oral glucose, which people can pick up in at a drugstore and put into their first aid kits if they have no diabetic. And somebody that drops rapidly, they can buy this and put it in their kit.
Okay.
All right.
So let's talk a bit about the other extreme now and what people need to do.
A person that has high blood sugar, the problem with first aid treatment of diabetes is that people that have high blood sugars, you can't check blood sugars. And we always recommend that if you don't have any training and there's nobody around that knows how to use a glucometer, don't go poking their skin to jet their blood sugar. So a person that has high levels of sugar will be the opposite. They'll have dry skin. They may be a little. They may have a fruity smell in their breath. And they'll be a little off, but not to the point where they'll be unconscious. It's a gradual increase in the sugar level, whereas hypoglycemia, a low blood sugar, will drop very, very rapidly and go unconscious very quickly.
Now, is that a situation where you need to call the paramedics as well?
Well, yeah, because too much sugar can put the heart into an arrhythmia. It can affect their heart detrimentally. So we always say that if you're unsure, treat them with sugar, because a little bit more sugar is not going to hurt them. But if they don't have enough sugar, they should get the sugar right away.
Is there one that happens more frequently than another?
The low blood sugar is the one that happens the most. And that's the one that we run into, and first aiders will run into the most, because it happens so fast. We'll get them on buses, at work, because they'll skip their breakfast before they come in the morning, or they'll take their insulin. Oh, I'm really rushed. I'll get a bagel or something, and then they drop before they get a chance to get it. So, first aiders will run into that the most.
Now, this is a great education. You obviously coming on the show on a monthly basis. Are there information resources out there for people if they want to learn more about this sort of thing?
The Canadian Diabetes Association. My nephew is a diabetic, and it's a great resource. And actually, diabetics themselves, if you go to them and you say, look, I know you're diabetic, can you give me some information? They should be the ones teaching the segment, because they are so well knowledgeable. They know so much more than I do because about their condition. You were saying you have a family member that's that way as well. So they're the ones, or you can go to the diabetes website. I think it's www.diabetes.ca, and that's the website you check out.
Terrific.
Thanks,
Again,
Rob.
great tips, Rob. Really appreciate you coming on the show each and every month.
Thank you very much.
Wow,
Okay.
you know, 2 million people, whenever I hear that,
huge.
I am still surprised. But we can do more to help. Now, don't go away, because when we come back, we're going to be talking about long-distance education online. We're getting tech-savvy here in our community. We'll be right back after this. Great.